Hi guys, welcome to my channel. As you know, I'm the Metabolic Health Doc, and I share messages of healing to help you achieve your metabolic health. Today, I am curious if you've ever wondered, what's a great test to help you understand how to know if you can reverse your type 2 diabetes. I think that's a really critical question because we live in a world where people think you can't reverse your type 2 diabetes. So I have a great friend and colleague, Dr. Sanghani, an endocrinologist who focuses on reversing type 2 diabetes in her clinical practice. And she's doing a really good job. So she's probably the right person we should be asking this question. So Doc, tell me what you think should be a great test that we should consider to understand if we have a chance to reverse our type 2 diabetes.
Yeah, thanks, Tony. First of all, thanks for having me and thanks for the work you do. I love that you're the metabolic health doc. We need like 1,000 of you
That's
everywhere.
right. You got that right. We're
So,
working
so
on
this
it.
is
We're
good.
working on it.
We're working on that one. So to get to your point, the test that really helps us, in endocrinology, we sometimes are the last person you might see when you have diabetes. We're like way out after your primary care and then your internal medicine, and then maybe we get referred last sometimes. And the test we would do, which I think more people should know about, is the C-peptide test. You can do that fasting, and it's a way to understand how much insulin your body's making. But if I were to give a simple analogy, is if you think of the traditional old-fashioned ballpoint pens that had a cap that you could take off, when you wanted to write, and then you put the cap back on so you don't ruin your shirt pocket. I use that example is when we make insulin, it's secreting around in the body. I'm a hormone doctor, so I like to explain how this hormone works is it's not active until you take the cap off, the way your pen is not active until you take the cap off. The C-peptide is what you take off of what's initially released by the pancreas. It's called proinsulin. So it's the precursor to active insulin. That C-peptide is that cap. And the active insulin will get released when you cut it off, the C-peptide. And the insulin will go around the body, do its job. And then within minutes, the insulin levels could be fluctuating. So it's not so accurate. If you want to know if somebody's body's making insulin, rather than look at the insulin, you look at the cap, which is the C-peptide. And that floats around in the bloodstream for a little longer and more stable to catch in the mornings. So that's one good reason to do it. The other good reason is if you have a patient who's taking insulin shots, then you don't get the answer from measuring insulin because you want to know what the body's making. And so the C-peptide tells you what the body's making.
I like that. And that's so nuanced. And I don't think the average clinician, particularly family practice like myself in internal medicine, would even think to distinguish those two. So this is not just for our patients to hear, but it's also for our clinicians to hear. And maybe a couple of other thoughts. And I just want to really emphasize if you are currently a type 2 diabetic and you've been that way for a while and you've never had the C-peptide test, that's a problem. Everybody should have that test to kind of see where you are. And because some type 2s actually can convert to a type 1. So we want to make sure we see that. And then there's other reasons why your C-peptide could be high. One of the things in our as the metabolic health doc, I like to have ways to measure metabolic health. And guess what? The C-peptide is a great measure of insulin resistance and metabolic health. Because if it's too high, that may mean that you're producing way too much insulin, and it could be an indicator that you're going to literally become diabetic down the road, or all those other metabolic diseases. And there's other things that we could spend a whole hour talking about, tumors of the pancreas and things like that. But at the end of the day, I wanted my colleague to come to this video to make sure that everybody who hears this video takes the time to ask their doctor to check this test. So thank you so much, Doc. But I also want to thank you for coming to the Protecting Your Nest podcast. We did a great podcast together where we shared more insights about why lifestyle is the key to achieving metabolic health. So thanks again for coming to this video. And until the next video, continue to be safe, be well, and continue to protect your nest.